So Randy, like I said, obviously I've known her since 66, 65. We're a little different stages in life, but her significant other is our corporate counsel. Plus, she's big in exercise, there's physiology, wellness stuff, and I've known her even for a long time because of that. And she also is friends with my wife and stuff like that. So she is part of our practice that we see non-occupational stuff, but it's part of injuries. And so she had a significant onset of sudden cervical pain, and she was absolutely freaking miserable. And so probably what we do here is different is we understand a sense of urgency. She was getting ready to go on vacation to Arizona. I mean, she was absolutely in terrible shape, pain, could barely move her cervical spine, and just was miserable. So I said, come on in, I'll see you. We did some x-rays on her, got her started some medication. She had some therapy with ATI. The nice thing with ATI is they're a national. And so she was able to have some therapy in Arizona. So that was helpful. And so she had some improvement. I'll let you kind of tell the rest of the story from there.
I really think I was moving out of my condo in Chicago, lifting too much stuff, too heavy for me, and dragging it. Next day I went to Body Pump, and Body Pump would do 200 clean and presses. I was like, uh-oh, that didn't feel right. And I felt frozen the next day. Felt like I really, Body Pump forever, but it's too many reps for a 71-year-old. But, I didn't slow down. I wanted
We're both kids at 71. Okay.
I got hurt. So, and that was, it was weird. Like, almost like my nerves, my jaw, my occipital area, my back. It was like all in my head. It wasn't even muscular. It was like, I felt like my head was frozen. It was sitting on my shoulders like I weighed 300 pounds. It was really weird, you know? So, and it's pretty tough. Lift weights all the time. I exercise all the time. But this time I did something to myself. Self-inflicted, I think. And maybe I was prone to it from posture, who knows what, right? Who knows? I carry my grandson around, who's 2, is really heavy for that too. So maybe all those things contributed, or maybe aging. I hate the word aging, but it's possible.
Well, she had some pre-existing degenerative changes, which is expected for somebody at her stage in life. But she was miserable, and so when she came back, I saw her again right away. We got her back in therapy here locally. We got her on some medications. We got her back in physical therapy, and I can tell just by looking at her how much better she was, because she was absolutely terrible. And so that's kind of what's about our facility here. When you're walking around, it's set up for injured people from start to finish, from diagnostic x-ray, being seen right away by myself. We have medical massage here, which is really a nice aspect with this, just separate, different from physical therapy. Then we have the physical therapy side there. And so it just basically, we're set up for people to fast track their injury care. She didn't have to wait around for weeks to get seen. One-stop shop, and that's the whole concept that we're trying to do, is offer some care in a very fast, urgent basis to help. And that's kind of what we did. And so her range of motion, bend your chin down.
Give me relief.
Back up. Okay, let's have you rotate like that. Other side. She couldn't do that at all. She was absolutely miserable.
And my left side was somehow the worst, I'm not sure.
Yeah, so she had spasms present, and she just could barely lift her arm up.
I lost my strength in my arm.
Yeah, so, when I did my exam before, she had limited motion. Now she's come back and stuff like this. Push out, push. Her strength's come back, push. She's having an MRI tomorrow. Up, resist. But based on this improvement, is substantial how much better she's doing. So
to get relief right away when you're really hurting is so important.
Yeah. So
because you're like, you feel frozen, you feel frustrated. I got some relief.
So that's kind of what we put together, is just rapid assessment, make a diagnosis, not screw around, get her what she needs. Plus, what I try to do differently than other physicians is all my patients get my cell phone. Sometimes it gets abused, but most of the time it really helps me do my job as a doctor because they know they can get access to me and I can take care of a problem faster and get them better. And that's kind of what we did, right? Make sense?
He heard I was going to Arizona. He said, we had ATI in Arizona. That was great. It was brand new in the injury. So not going for 10 days would have been terrible. I'm not getting any better. Probably go back to the beginning. So going to ATI in Scottsdale, Arizona was great.
There was continuum of care, and that's what we're trying to do.
I'm going to go to South Carolina tomorrow, and I'm going to go there too, to ATI. So it's really helped.
Yeah.
And
So
come back here and go to ATI here.